Welcome, my name is Ben Booth, and this is Big Sky Voices.
My name is Johonniuss Chemweno with Inverse Medical.
And it's so delightful to have Johonniuss here. Johonniuss has founded, is president of, and is a well-known executive in the healthcare business.
Yes,
is that close enough?
Yeah, that's perfect.
And we've been very impressed with him. And also, a new thing that he's doing for the movie industry as a consultant to help large movie sets when they have a healthcare need or an emergency. He will tell them where to go and make arrangements and whatnot. So, boy, it's such a pleasure to have you here.
Thank you, Ben. Thank you for having me.
What I want to know, number one, tell us about your background. How did you get to where and what you are doing now? Because I'm so impressed with you.
Thank you, Ben.
Go.
Yeah, it's always interesting to see how healthcare delivery has changed and transitioned from the early 1800s to 2018, where we saw kind of a change in the late 1800s of how do we treat a patient that has gotten severely injured on the Civil War battleground, right? Your gunshot wound, and how do we get the right dressings on him and help this guy prevent death, essentially. So we go from Civil Wars to World War I to the current status of just your normal everyday visit to see your doctor. So we see that transition, and that's one of the reasons why we started Inverse Medical, to essentially help these patients that suffer from certain types of complications, help doctors with what they're trying to achieve for their patients, and so on and so forth. So yeah, that's essentially how we're here.
But you don't deal with just simple things. You deal with some very complex issues.
Absolutely.
And some very complex equipment that you make available for your
Absolutely. So we have essentially partnered with physician groups, hospitals, surgery centers, outpatient clinics to provide services that will really reduce patients from the narcotic and opioid epidemic that we see in today's world, as well as your more complicated disease states such as lymphatic disorders, patients that could develop blood clots in the outpatient setting, to patients that have chronic venous insufficiency, which is a reduction in the blood in the lower extremities. So we deal with more complex things to also your everyday needs, in terms of doctors that need surgical implants, implantable medical devices there in the hospital setting.
Where I got to know Johonniuss, I had to have a knee replaced recently, and I also had a client call me and ask if I could go to Indonesia to help them with a toxic chemical spill on an oil platform. But the problem was, after you've had major surgery, you already know.
Absolutely.
You have to be careful about blood clots. You have to keep that circulation going.
Absolutely.
And so the doctor said, well, you need to be sure and use this equipment, and I'll order it for you, because 20 hours on the airplane is dangerous. Your blood thickens, and it's like.
Absolutely.
And so I was so impressed with the Johonniuss and his bunch. They actually brought the equipment to us, showed us how to use it.
Absolutely.
And then if we had a question, they were there. And then when we were through, they came and picked it up. It's just a wonderful service from our home. And I suspect if I had to take that with me to Indonesia, you would have said, yeah, here's how you work it. Do they work on batteries or something? I don't know.
No, so it's, there's so many different devices.
Yeah.
I mean, depending on if someone's traveling, if they're in their home setting, or if they're staying in the hospital, there's various medical devicies that we offer depending on the situation.
Yeah.
So if you say, hey, Johonniuss, I'm traveling to Indonesia, we just say, hey, maybe this is going to be the best since you're going to be on an airplane for 20 plus hours.
Yeah.
So we might have made some changes depending on the physician.
But I was thinking of you, Johonniuss, this morning, because last year we had a film group that did some filming out in the literally out in the countryside between here and Raton.
Oh wow!
And so they had a set out there of about 20 trucks, and sound trucks, lights, equipment, and people, and there were mobile homes out there. I don't know if they stayed out there, if they put their shot, or if they drove into some town, but the fact that they were out there in the middle of nothing, working off of generators, and real horseback. I can just imagine how many of these actors fell off of their horses, or broke an ankle, or cut themselves on a barbed wire fence or something. And you would be the kind of guy that movie director could call and say, hey, I've got a problem here. How do I get an ambulance here? Which hospital should we go to?
Absolutely.
And not that you're a doctor.
Absolutely.
But you know how to make it all happen, right?
Absolutely. We can have this way of providing services through what we would call like an integrated delivery network.
Yes.
Which is really a network of providers, a network of hospitals and surgery centers and clinics and third-party companies to make sure that we bring them all together to make sure that we put the patient first.
Yeah. Well, tell me, I read the paper every day, and it looks like our Medicare system, our medical care system, our healthcare system, Medicaid, all of these things are in deep flux.
Absolutely.
And indeed, when I was at the hospital working on my knee deal, you know, they said, it's good that you're getting this done now. And I said, why? And they said, well, because of your age, Medicare will pay for a lot of this expense, most of it. And but then they said, we've heard rumors that there are people in Washington that want to eliminate or cut down on Medicare, Medicaid.
Absolutely.
If they do that, there's going to be millions of people that are going to be confused or displaced or anything.
Absolutely.
But what are you seeing? Am I imagining?
No. You're spot on, Ben.
Yeah.
There has been, you know, for the last 10 years, complete changes to healthcare delivery as a whole in terms of how patients get various services, whether they're elective or emergent services. So what we've seen at the grassroots level, as well as our relationships in terms of how we try to align ourselves with different types of government initiatives, private commercial initiatives in terms of how the private payers play a major role in our healthcare decisions on where we go, how we get our services, and when we get our services for the most part. So what we're seeing is further alignment with health insurers, i.e. Medicare, Medicaid, from your federal government payers to your private payers, align themselves further with the hospitals, the providers, whether they're a hospital, a clinic, or a doctor. We're seeing a mission that the payers and the government are leading from Washington, D.C. to further provide alignment in terms of reducing costs.
I see.
So the question is, how do we reduce costs? And that's the million-dollar question, right?
Yeah.
And so our company's there to provide that intermediary to help look at value-based care at the end objective, which is to reduce costs by providing care up front, to reduce patients going back to the emergency rooms, to the urgent cares, which overall really increase cost. If we can prevent those things at the up front, then that's really our goal.
We do sometimes appraisals and feasibility studies for new hospitals that are going to be built. In the last 3 years, we have had a number of clients come to us, and they've said, we're going to spend $50 million, but it's not going to be a hospital.
What is it going to be?
We're going to call it a clinic.
Yes.
And we're going to put it next door to a hospital, and we're going to partner with that hospital, so they can be the official contact with the government. And we will run our patients in a partnership basis through them.
Oh, interesting.
And so instead of us building 100 or 200 beds, we'll use their beds because all the hospitals have excess beds.
Absolutely.
And in that way they save cost in construction. Instead of having 2 MRIs, they have one.
They have one. Absolutely.
And instead of, and whatnot.
Yes.
But I've had several people in Washington and in New York City tell us that ultimately we will go to a single pay system. What do you think? And maybe you can tell us what that is.
Well, okay, so a single payer system is essentially one payer. It's eliminating the private payers for the most part and having it ran through the government. And I have an interesting story that I
So that would be like Medicare.
That would be Medicare for all.
Instead of Blue Cross Blue Shield
United
and
Healthcare,
Medicare, we just have the Ben healthcare system.
Correct.
And you just pay them and they take care of everything. If it works as well as Medicare, it looks like it would work well, I would think.
It could. It all depends on how it's administered and who's calling the decisions on medical necessity in terms of, you know, physicians interacting with their patients and how that really looks like and what that looks like, I should say. If you look at a single payer system versus the system that we currently have, some will argue that the current system we have ran through the private payers is pretty efficient. Patients or employers pay premiums and they cost share between their employees. They offer their benefits or healthcare benefits to their employees, and the payer winds up paying for different medical bills related to the services that they receive. Between the employer-based system and a single payer system, there are major differences. And what we've seen in the last 10 to 15 years is that Medicare has moved, or Medicaid, I should say, CMS, has moved to having the private payers administer the Medicaid benefit for those Medicaid beneficiaries. So, for example, you have major insurances like United Healthcare that will have a Medicaid division that essentially administers the Medicaid benefits for those members or for those patients. So if we look at that trend, I would say with the current administration, it looks like they're going to further that trend to move Medicare as a government benefit into the private payer marketplace, so that consumers still can get their Medicare benefits through a major managed care organization such as United Healthcare, Blue Cross Blue Shield, Aetna, Cigna, so on and so forth.
So that won't be a whole lot different than what we've got, really.
No.
But do you think it'll ever go to where there's just one?
That's a hard question to answer. I would say
not under this political regime.
No, not under this administration.
Yeah.
But you will see further cost cuts
Yeah.
in terms of how healthcare is delivered. So what we've seen on our end is they're looking at redefining what a benefit really is for that patient. Should we offer certain types of ancillary services? Should we revisit medical necessity and the clinical studies behind it? Can we further align ourselves with narrowing provider networks that will, in the end, reduce costs?
Right.
So really, you're seeing further consolidation between the payers, the pharmacies, such as a recent merger between Aetna and I believe it might have been CVS. I might have that backwards. So you're seeing further consolidation, further alignment between what I would call the three-headed monster.
Yeah.
I always look at healthcare as a three-headed monster because you have hospitals as one part of the one head of the monster.
Right.
You have insurance payers as
Right.
the other, and then you have doctors or
Right.
providers. So between those three, they all have conflicting interests. Doctors see the patient as the patient.
Right.
I need to take care of my patient. Insurances are in it for as a business, as a private organization, typically. Some of them are publicly traded, right? But they have different conflicting interests between the doctors. And then you have the hospitals that are there as an intermediary, right? And they all conflict because they have their own interests. So if you can further, I should say as a system of healthcare as a whole, can further align those three, then healthcare delivery could be pretty amazing.
Well, now, you're the president of the company.
Yes.
You're the boss,
Yes.
the CEO. You
Yes.
make the decisions. You're
Yes.
ordering equipment and leasing equipment, and you've got people delivering
Correct.
and teaching.
Yes.
And then I assume you're doing more and more consulting. That's going to be
Absolutely.
more and more education. And
Absolutely.
everything.
Absolutely.
It seems like to me you're in an absolutely great field because
Absolutely.
everyone that talks about the medical healthcare system is totally confused about it.
It's very confusing.
They don't know
It's very confusing.
how to work their way through it.
Yes.
But furthermore, people like me who I have 4 companies.
Okay.
We need to talk to people like you to say, how do we make the next decisions for the next 5 years for our companies, for our
completely
people?
agree.
you know?
Absolutely.
Or again, that movie company.
Absolutely.
We need you as a consultant for 40 days while we're shooting in the desert or wherever they're
Yes,
doing,
yes,
and
yes.
whatnot. And so it seems like to me that your industry is destined for growth regardless. Would you agree?
Absolutely. And not only that, when you talk about having a source as a consultant to help walk people through a very complicated system, really we're thinking of bundling a service from consulting to understanding healthcare delivery to actually providing the delivery for certain types of services. And really that goes back to alignment, right? It goes back to aligning all of the parties together to make sense of the entire process.
Sure.
So making it less complicated, right? So when patients like yourself or myself see all of these different doctors, that it's consolidated in terms of understanding what I'm responsible for,
Yes.
how much I need to pay for the services I just received, and maybe minimizing my share and putting the burden back on the insurance company since I'm paying my premiums, right?
Well, I'm just glad there are companies like you and people like you out there.
Yeah.
As a company that provides equipment and services and education
Yes.
and some consulting, you would be in a position to tell an individual, well, this group here is better at this area.
Absolutely.
Or these doctors, they've got a team there that does this well.
Absolutely.
Or these are better at a big organization.
Yes.
Or this might be better for a mom and pop type deal.
Yeah, absolutely. Absolutely.
If someone wanted to email or call you, what would be the best way they could get in touch with you or your secretaries or your staff?
Yeah, absolutely. We have a great team there at Inverse Medical. We
you're
are
located right
yeah,
here in
we're
Albuquerque.
right here. Our headquarters are right here in Albuquerque, right off Jefferson, Alameda area. And the best way to call us is, or get in contact with us, is by phone, 505-389-2279. Or you can email us at info@inversemed.com. You can stop by our office to get further information. really we try to make ourselves accessible. We're also 24 hours a day, 7 days a week.
Okay.
So if someone needs to get in contact with us, we have an on-call number that they can call us, and pretty much we're pretty accessible.
But if someone just called you and said, hey, we're moving our company to town, or we're about to open a new business, or we need some help, which is the best hospital, that sort of thing, would you charge for that kind of information or consulting, or is that kind of like they give you a few minutes free at the beginning to see what you need, or what?
Yeah, that's just more of understanding their needs.
Yes.
Once we understand their needs, we can definitely put the right parts in place to make sense of what's available in the marketplace. And Ben, that actually brings me up to another question or another statement, I guess, in terms of really what's going on in New Mexico.
Yeah.
So what's going on in New Mexico right now in a managed care state, and I'm guessing it's probably not just New Mexico, but other managed care states like Utah that has their own health system that also employs their own doctors.
Yes.
That's what managed care is they can control the entire process.
Right.
What's going on is you see more and more physicians leaving the state, less doctors wanting to become doctors.
Notice that.
So with that trend and seeing how that trend is going to continue to go, there's a lot of questions that employers should be asking. There's a lot of questions that employees should be asking if they're going to relocate to this state. Do I have healthcare access to doctors? Can I get a doctor for my family, for my kids, if I'm going to move into this state? What does that look like in terms of how long I might need to wait to see a doctor, so on and so forth.
Yeah.
So there's several questions that one employer should be asking and further understanding. Two, employees of those employers should also be asking, especially the film industry, right?
Oh,
If I travel and I'm there for 6 to 8 months filming a new movie, then I should understand. Do I have a doctor to see if I get hurt, if I break a leg when I'm doing a very...
You can't afford to wait 6 weeks for an appointment.
You sure can. You sure can. So that's really what we're there for.
Yeah.
And if you look at what's going on in our economy, you look at Amazon taking over.
Yeah.
Amazon has made it accessible for people just to drop ship drop ship whatever you order right to your front door. 2-day delivery, maybe 1-day delivery via FedEx or UPS. So if you look at how our economy is kind of recorrecting itself, it looks like more and more people are willing just to come to your home for a home visit, such as a doctor back in the 1800s saying, knock, knock on your door, how are you doing, Mr. Booth, right? So maybe we see the future kind of going back. No, we need to change that. We need to incentivize doctors to become doctors, this young generation of people that are 16, 17 years old saying, what do I want to be when I'm older?
Yeah.
Back in 20 years ago, I wanted to be a doctor. Not me, myself, but people would say that, I want to be a doctor, I want to be a scientist, I want to be an engineer, I want to be a lawyer. But now the economy is a little bit different. To be a doctor today is very, very difficult. It's not, I just want to take care of a patient. I have to have some type of a business sense. I have to understand health insurance.
Sure.
I have to think of all these other regulated things, I would say, than just the patient, right? So to be a doctor isn't like it was 20 or 30 years ago. There's a lot of other things that they have to think about and make decisions on.
Are they not being paid enough? Because when I was a bank president, for 20 years, most of my doctor clients were making $300,000, $400,000, $500,000, $600,000 a year. They were doing all right. Is that not enough to keep them happy in the current?
Well, it depends on the specialty, right?
Family
Family
maybe
practice,
they're not being paid
primary
that much
care.
in New Mexico. I don't know.
No, I would argue that doctors aren't being paid enough today. With all the additional work that they have to do to get the reimbursement that they used to get without all those additional layers, it was a lot easier then. I could see a patient. The patient can get seen, I could bill the insurance company, and I would get paid for that. Now there's all these other things that doctors have to take into consideration. Value-based reimbursement is what it's being considered at. Let's think about patient outcomes. Let's measure their improvement scores in terms of saying how well you're doing, Mr. Booth. Let's manage that outcome long term, and then I can get paid maybe a higher or a lower or an average reimbursement. So they're taking all these other things into consideration in terms of how much they should be paying physicians. Absolutely. One, we have to increase health to the Native American community. And not just the Native American community, but communities that suffer from very complex medical conditions such as diabetes. So there's a lot to consider.